The Gauteng government has been hard at work in testing efforts. The Health MEC, Dr. Bandile Masuku, has promised that the province is doing its best to clear the testing backlog. Contact tracing and allocating resources to various health institutions has also been the center of attention. For more on this, I'm joined by Jack Bloom, the DA's Shadow MEC for Health in Gauteng. A very good evening to you. I guess it's still afternoon. A very good afternoon to you. Thank you for joining us. Now, from your perspective, has the provincial government done well so far? How would you rate their response regarding COVID-19?
Well, we had the lockdown, and the need was to take the opportunity of the lockdown to provide facilities. They have been putting up extra beds. I don't think we yet have enough. We need to have more field hospital beds and make sure that we are able to staff them. We're very short of ICU beds. It could be close to 7,000 shortage if we hit the peak and we haven't put in extra beds. And we need to recruit more staff. The Gauteng Health Department has said that they are recruiting more staff. I think they should have actually done this a bit earlier. But we're all learning with this epidemic. It's really, we need to do the best with what we have. But unfortunately, projections that we have as of today is that there will be quite a large gap both of general beds and more seriously of ICU beds, because that's critical in saving lives.
The Newzroom sector has now come into operation. Do you think that will suffice, or that perhaps needs to be extended?
I think we need extra beds in addition to Newzroom. The provincial government has said that they are going to be extending the field hospitals. It needs to be around the province. I mean, we need in the Tshwane area, in the West Rand, they've actually commissioned a hospital that Anglo Gold Mining has given to them. I think that's very good. I think they need to move with all haste. But as I said, it's not just beds. We need equipment. We need staff. We need adequate quarantining. The problem is that once people are diagnosed positive, if they're not able to isolate at home without infecting their family, they need to go into quarantine, and we need those facilities urgently, because the main issue really should be prevention. And I would want to urge everybody to follow the rules, wear a mask when you're outside, socially distance, just take precautions, wash your hands. We really need to prevent infections if at all possible. But unfortunately, the trend, as we've seen, is we're now getting more than 2,000 cases a day. In terms of active cases, we now have more than the Western Cape. And we're not sure when this will actually peak. The provincial government thinks towards the end of August and September. It might be a bit earlier. I'm hoping that there's a seasonal element to this and that it gets much better when spring comes round. But I think the principle of this is that we have to plan for the worst and hope for the best.
What you've done, you've highlighted some of the major issues, and also you've brought up some of the solutions that should be tabled to overcome those issues. What do you believe needs to be done in order to position the province to succeed in dealing with COVID-19 beyond this current crisis? Because we do know that this is a disease that is set to be with us for a long time to come.
Well, we still mustn't give up on the prevention efforts, and I must say it's disappointing that the taxi industry is not cooperating, and I can understand the economic aspects of this, but really transport could be a major spreader of this disease, as we've seen overseas. So I'd like some rational, reasoned heads if we could come to a deal with the taxi industry. People do need to get to work. You see, unfortunately, we have to balance priorities. People could die. I still think that more people will die probably of other diseases than COVID-19 because we have to look at the health system as a whole. I think it's very important that immunizations continue. I think it's extremely important that TB patients collect their medicine, HIV/AIDS patients collect their medicine, that cancer treatment continues. I know that they've had to cancel elective surgery, but people still have heart attacks, and there's still accidents happen. The tragedy, of course, is that our casualties are now filling up with road accidents and crime victims. It's going to be a very stressful period for everybody. But I do think also we need to pay attention to protecting our health workers. What you find in overseas is that hospitals are where the disease spreads, if not adequate precautions. And I think we must take extra precautions to look after our elderly. What we found is that old age homes overseas, once they're hit, it can spread through the entire old age home. And of course, we know there is an age-related mortality. I think we have to take special care of the vulnerable. That would be people over a certain age, I'd say 60 and upwards. But anybody with a comorbidity, in fact, diabetes seems to be the most serious comorbidity.
I'd like to, our time is fast running out, but I really would like to ask you this particular question before I let you go. We've just heard now from Santaco and the decision that they've made, that come tomorrow they're going to be loading 100% capacity in their taxis. We know that they had been waiting for the Minister of Transport to get back to them. The Minister had said that he will talk to the NCCC and also get some scientific feedback on the health risks of loading a full capacity in a taxi. Your comments on that, and perhaps what risks you think would be associated to that, if any?
Well, it's of great concern because you could imagine people jam-packed in a taxi. That's how this can spread. I'd hope they're all wearing masks, and I would advise very strongly that the windows are open. I know it's winter and it's cold, but the windows must be open. It's of great concern. I hope that government and the taxi industry can resolve the issues, but honestly, to have a fully packed taxi in the middle of a raging epidemic, the health consequences are appalling. But I'd hope that some arrangement can be made. We need to obviously look at the economic factors, but we cannot allow the risk of spreading this in this way.